I just want to be clear to the House. We do not have a vaccine yet, but we are one step closer. There are many steps still to take. The full safety data is not yet available, and our strong and independent regulator, the MHRA, will not approve a vaccine until it is clinically safe. And until it's rolled out, we won't know how long the effect lasts for, or its impact not just on keeping people safe, but also on reducing transmission. As Deputy Chief Medical Officer Jonathan Van Tam said yesterday, it's like the first goal scored in a penalty shootout. You haven't won the cup yet, but it tells you that the goalkeeper can be beaten. And beat this virus we must, we can, and we will. Yesterday's announcement marks an important step in the battle against COVID-19. But as the Prime Minister said, we must not slacken our resolve, and there are no guarantees. And so it's critical that people continue to abide by the rules and that we all work together to get the R number below 1. Mr. Speaker, if this or any other vaccine is approved, we will be ready to begin a large-scale vaccination programme. First, to priority groups, as recommended by the Independent Joint Committee on Vaccination and Immunisation, before rolling it out more widely. Our plans for deployment of a COVID vaccine are built on tried and tested plans for a flu vaccine, which we of course deploy every autumn. We do not yet know whether or when a vaccine is approved, but I have tasked the NHS with being ready from any date from the 1st of December. The logistics are complex, the uncertainties are real, and the scale of the job is vast. But I know that the NHS, brilliantly assisted by the armed services, will be up to the task. I can tell the House that last night we wrote to GPs setting out £150 million of immediate support and setting out what we need of them, working alongside hospitals and pharmacies in preparing for deployment. The deployment of the vaccine will involve working long days and weekends, and it comes on top of all the NHS has already done for us this year. And I want to thank in advance my NHS colleagues for the work that this will entail. I know that they will rise to this challenge of being ready, when the science comes good, to inject hope into millions of arms this winter.